Okay, let's talk about facelifts and what's new with facelifts today, and specifically what we've been doing in our office that's different in the new market of facial rejuvenation. Now, for years, facelifts have been out there. I have been in practice for 32 years and have done facelifts since my residency. And I could frankly say that the procedure that I did 32 years ago is completely different than the one we do today, which is quite different from some of the other operations that plastic surgeons do. Why is that? I think as the years have gone on, aesthetic plastic surgeons have sought the ideal. I think we all realized years ago that that pulled, flat look was very artifactual and really didn't connote the essence of beauty or youthfulness, but looked like you had surgery. As the years have gone on, most patients are clear. Their biggest fear is that they don't want to look like that, and indeed, I don't want my patients to look like that. The biggest smile on my face comes on the second or third day after surgery when I look at my work and I see my patients looking rejuvenated, youthful, and beautiful. But no one could tell that they had a facelift with the old artifacts and the signs that we all expect to see. How does that happen? So here's the differential in today's day and age. A couple of years ago, it was apparent to me, as someone who really wanted to take his practice in the direction of doing facelifts almost exclusively, that I had to look at the market as to who wanted to have facelifts or neck lifts. It was a different market than when I was a younger plastic surgeon. In those days, it was movie stars, celebrities, wealthy women. So they really presented a different issue for a plastic surgeon because they actually were happy with this weird look, because as I would say in those days, they wouldn't get out of bed before putting their makeup on. So if you as an artist were allowed to make a sculpture, but you knew it was going to be painted different colors every day to create the essence of what it was, you would have a different sculpture than the one that was always going to be raw or have its natural patina, which is the way women want to look today. With that said, women wanted to have, and men wanted to have, a procedure that did not cost a tremendous amount of money. I use this metaphor all the time. It's maybe half of what you might use to go to the Bahamas for a week. So it's a good investment. The second was they were petrified by going to a hospital where there are untowardly germs and different staff than the specialized people that we see in someone's office when you have a plastic surgery office. Most importantly, they did not want to have general anesthesia or go to sleep. That was music to my ears because I never liked general anesthesia for a facelift because it distorted the face. Think about this. When you go to sleep, someone puts a tube the size of a hose down your throat and pulls your whole jaw down. Number one, I felt claustrophobic, that other people were getting involved in my work. Not a good feeling. And most importantly, it distorted the face, the jawline, and the neck, so you couldn't really see what you were creating. So under local anesthesia, it's great for me because I'm in control of the face. I could see every angle, every nuance, every shadow. But most importantly, the patient doesn't have the risk of a general anesthesia or the recovery of a general anesthesia. That was a deal breaker. And patients really came forward once we started to do this in the office, under oral sedation, with local anesthesia, with complete comfort and lack of any memory for the procedure. And the final thing was the natural look. And how do we achieve that? So once again, I use this metaphor. So you're looking at a very messy bed, and you call in your maid, say, I want that bed to be tidy and look tight. So the sloppy, old-fashioned, lazy maid just takes the top sheet of the comforter and goes, and makes it really tight. So now it looks tidy, but you feel with your eyes, this is tight. That's the old facelift. What we do is we take the comforter off, we layer out all of the feathers and the mattress and the bottom sheets, and then put the top sheet over and the comforter in a nice even fashion so it looks tidy and neat, but not tight. And how do you do that? So the issue is people think the skin is the basis of the tightening of a facelift. It is not. It simply reflects what we do down below. So through the common incisions that run very inconspicuously around the ear, we lift the skin, the top sheet of the bed, and I do all of my work down below. So watch my face. So if you look at my face, when I was young, all of the fat was up here in my cheekbone. With time, it fell off my cheekbone, it fell down, my face got somewhat flat, it develops a nasolabial fold, a prejowl sulcus, a marionette line, and a jowl. So look what happens if I ignore my skin and just lift that piece of fat back up into my cheekbone. This ameliorates, this goes away, my jowl goes back into my cheek, and I have a nice confluent OG curve at my cheekbone. That is useful. Then you lay the skin over, don't pull it, don't flatten it, you trim the skin, and you're done. In the neck, we actually take the muscles of the neck and sew the muscles together through a very small incision in the submental crease. Tighten all these muscles so you look just like that, which really lasts for a long time at looking very natural. The trick is putting all of your work down below because it looks very natural. You mimic the underlying structure so the person never looks weird or not like themselves. The result lasts for a long time because you're placing your result on fascial tissue, which is very strong and does not age at the same rate as skin, which is exposed to the environment. And the results, to me, are the best that I've seen in 32 years. So now we have the best operation, the least amount of involvement of the patient with anesthesia, a good price point, quick recovery, happy patients, great operation. End of story.